Imagine you are sitting in your favorite armchair, reading a book or watching the evening news, when you notice a slight tightness in your jaw. You figure you just chewed something wrong at dinner, or maybe it is just stress. You ignore it, pour a glass of water, and go to bed. But what if that tiny, barely noticeable sensation wasn't stress at all? What if it was your heart quietly flashing a red warning light, trying to tell you that its time is running out? Welcome back to Dr. Reeves. If you are over 65, you already know that your health is your greatest wealth. But here is the terrifying truth most physicians do not tell you. Your heart rarely fails out of nowhere. Long before a major medical emergency occurs, your body drops subtle, quiet clues. The problem is, most of us are looking for the wrong clues. We are waiting for the dramatic, movie-style chest pain, while completely missing the silent whispers of a failing cardiovascular system. Today, we are going to look at the 7 hidden signs that your heart is in serious trouble, including one bizarre symptom in your legs that most people mistake for simple aging. If you miss these signs, the consequences can be sudden and life-changing. But if you catch them early, you can protect your independence and add decades of vibrant health to your life. Before we dive into the first sign, I want to ask you a quick question. Drop a comment below right now and let me know. Have you or a loved one ever had a sudden health scare that completely caught you off guard? I read every single comment, and your stories help our entire community stay vigilant. Now, let us talk about a man named Arthur, because what happened to him is the perfect example of how the first hidden sign creeps up on you when you least expect it. Sign number 1. The deceptive exhaustion. Arthur was a 72-year-old retired school principal from Ohio. He loved working in his garden, tending to his prize-winning tomatoes, and taking his golden retriever, Max, for a daily stroll around the block. For months, Arthur noticed he was getting unusually tired by early afternoon. He wasn't doing anything heavy, just his usual routine. He figured, well, I am in my 70s now. This is just what happens when you get older. He started taking longer naps and cutting his walks with Max short. But then, things took a turn. One morning, Arthur walked out to his driveway to grab the Sunday paper. It was a completely flat walk, less than 50 feet. By the time he picked up the paper and turned around, his legs felt like lead, and his chest felt strangely empty, like he couldn't quite catch enough air to satisfy his lungs. He had to sit on his porch steps for 10 minutes just to recover his strength. He thought he was just out of shape. What Arthur didn't realize was that his heart muscle was steadily weakening. You see, your heart is a master pump. Its only job is to push oxygen-rich blood to every single organ, muscle, and tissue in your body. When the heart begins to fail or the arteries narrow, it can no longer keep up with the demand. Your body is incredibly smart, so it makes an executive decision. It pulls blood away from non-essential areas, like your leg muscles and your skin, and channels it strictly to your brain and vital organs. That profound, heavy exhaustion Arthur felt wasn't old age. It was his muscles starving for oxygen because his heart couldn't deliver the goods. This matters immensely because ignoring this type of fatigue is like driving your car with the oil light flashing. If you keep pushing, the engine will eventually seize. For a senior, ignoring chronic, unexplained exhaustion means you are allowing your heart muscle to strain under immense pressure every single day, which drastically increases the risk of a sudden catastrophic event. If you find yourself modifying your life, skipping activities you used to love because you just do not have the energy, or if a flight of stairs suddenly feels like climbing Mount Everest, do not chalk it up to a birthday. Start tracking it. Notice exactly what activities leave you wiped out. Bring this specific log to your doctor and ask for an echocardiogram, which is a simple, painless ultrasound of your heart that checks exactly how well your pump is functioning. Arthur's fatigue was just the opening act, but what happened next to his feet changed everything. And it brings us directly to our second sign, which is an error millions of Americans make every single day. Sign number 2, the socks that leave a mark. Arthur started noticing that at the end of the day, when he took off his tube socks, there was a deep, angry indentation around his ankles. It looked like the elastic was just too tight. He actually went out and bought wider, loose-fitting diabetic socks, thinking that would solve the problem. But a week later, he noticed his favorite loafers felt incredibly tight by 5 in the afternoon. His ankles looked puffy, almost like they belonged to someone else. He showed his wife, Martha, and she suggested he cut back on salty foods. They thought it was just fluid retention from a salty dinner the night before. But over the next month, the puffiness didn't go away. It crept up his shins. If he pressed his thumb into the front of his shin bone for 5 seconds, a deep dimple remained in his skin for nearly a minute after he lifted his thumb. Here is what was actually happening inside Arthur's body. When your heart pump weakens, it loses the strength to pull blood efficiently back up from your lower extremities. Blood begins to back up in the veins of your legs. Because of gravity, that backed up fluid has nowhere to go, so it leaks out of your tiny blood vessels and into the surrounding tissues of your feet, ankles, and shins. In medicine, we call this peripheral edema, but you can think of it as a plumbing backup. Your heart cannot clear the fluid fast enough, so it pools at the lowest point of your body. Why should you care about puffy ankles? Because fluid retention in the lower body is one of the most reliable visual indicators of congestive heart failure. If your heart is struggling to circulate blood, that fluid does not just stay in your legs forever. Eventually, as the backup worsens, that fluid can begin to migrate into your lungs, making it incredibly difficult to breathe, especially when you lie down to sleep at night. If you notice that your shoes are suddenly too tight, or if your socks are leaving deep, lasting rings around your legs, do a simple test. Press your thumb firmly against your shin bone for 5 seconds. If a dent stays there like Play-Doh, your body is holding on to fluid. Reduce your sodium intake immediately. Elevate your legs above your heart whenever you are resting, and schedule an appointment with your doctor. They can prescribe a simple water pill to help your kidneys flush that extra fluid out, taking a massive load off your struggling heart. But as Arthur discovered, fluid backups do not just show up in your feet. Sometimes, they manifest in a way that completely disrupts your sleep, which leads us to our third warning sign, and it is something most seniors blame on their bladder. Sign number 3, the midnight cough that won't quit. A few weeks after his ankles started swelling, Arthur developed a dry, hacking cough. It didn't feel like a cold. He didn't have a fever, a runny nose, or a sore throat. The strange thing was, during the day while he was upright and moving around, the cough was barely there. But the moment his head hit the pillow at night, his throat would tickle, and he would break into a fit of coughing that left him gasping for air. He tried taking over-the-counter cough syrups, throat lozenges, and propping himself up with 2 extra pillows. Nothing worked. He told Martha he thought he was developing late-onset asthma, or maybe an allergy to their new mattress. He was waking up 3 or 4 times a night, exhausted, clearing his throat, and coughing up a thin, frothy, white sputum. This becomes even more important when you understand how body position affects your circulation. Remember how we said fluid pools in your legs during the day due to gravity? Well, when Arthur laid flat in bed at night, gravity changed. All that extra fluid that was trapped in his legs suddenly rushed back into his bloodstream. His weakened heart couldn't handle the sudden surge of volume. The blood backed up into the blood vessels of his lungs. To relieve that immense pressure, fluid began to leak into his air sacs. His body's natural reflex to fluid in the lungs is to cough it out. Arthur wasn't suffering from an allergy. His lungs were literally battling a slow influx of fluid because his heart pump was failing to keep the highway moving. If you ignore a nighttime cough that produces frothy or pink-tinged fluid, you are risking a severe medical crisis called acute pulmonary edema. This is a life-threatening situation where your lungs fill with fluid rapidly, making you feel like you are drowning while sitting right up in bed. It is one of the most common reasons seniors end up in the emergency room in the middle of the night. If you have a persistent cough that gets significantly worse the minute you lie down, or if you find yourself needing to sleep in a recliner chair just to breathe comfortably, This is an urgent signal. Do not use cough medicines. They will not fix a heart issue. See a cardiologist immediately. They need to adjust your cardiac medications to help your heart pump more effectively and prevent that fluid from entering your respiratory system. Now, while Arthur was dealing with his lungs, another senior named Evelyn was experiencing a completely different symptom that she thought was just a normal part of getting older. But it nearly cost her everything. This next sign is something that happens right inside your chest, but it doesn't feel like pain at all. Sign number 4, the flopping bird in the chest. Evelyn was a vibrant 74-year-old grandmother from Texas who loved playing bridge with her friends every Tuesday. One afternoon, while shuffling the cards, she felt a sudden, strange sensation in her chest. It didn't hurt. It felt like a small bird was trapped inside her ribs, frantically flapping its wings. The feeling lasted for about 20 seconds, and then her rhythm went back to normal. She took a deep breath, drank some sweet tea, and went back to her game. Over the next few weeks, that fluttering returned. Sometimes it happened while she was washing dishes, sometimes while she was reading. Sometimes it felt like her heart completely skipped a beat, followed by a heavy, thumping thud against her chest wall. Evelyn figured it was just from her morning cup of coffee, or maybe she was a little anxious about an upcoming family visit. She ignored it because, after all, there was no pain, and that is where things get dangerous. What Evelyn was experiencing were heart palpitations caused by an irregular heart rhythm, most likely a condition called atrial fibrillation, or AFib. In a healthy heart, the upper and lower chambers beat in a beautifully synchronized electrical dance. But as we age, wear and tear or high blood pressure can disrupt those electrical pathways. Instead of a strong, steady squeeze, the upper chambers of the heart begin to quiver chaotically, like a bowl of jelly. That quivering is what caused the fluttering sensation Evelyn felt. Why should you care about a fluttering feeling if it doesn't cause pain? Because when the heart quivers, instead of squeezing firmly, blood stagnates and pools inside the crevices of the heart chambers. When blood sits still, it forms clots. If your heart suddenly snaps back into a normal rhythm, it can pump that newly formed clot straight out of the heart, up the carotid arteries, and directly into your brain. AFib multiplies your risk of suffering a devastating ischemic stroke by 5 times. It is a silent stroke machine. If you ever feel your heart racing for no apparent reason, fluttering, jumping, or skipping beats, do not wait. Check your pulse on your wrist. Is it beating like a steady clock, or is it completely chaotic and unpredictable? If it feels erratic, you need an EKG right away. Doctors can give you a small, wearable monitor to catch these irregular rhythms. And there are excellent medications and procedures available today that can normalize your rhythm and virtually eliminate that terrifying stroke risk. We are halfway through our list, and if you are finding this information valuable, please take 1 second to hit that subscribe button right below this video. By subscribing to Dr. Reeves, you are ensuring that you never miss these life-saving health breakdowns, and you help us share this vital medical knowledge with seniors all across America who need it most. Thank you for being part of our family. Now, let us move on to the 5th sign, which is perhaps the most frequently misdiagnosed symptom in older adults, because it doesn't feel like it has anything to do with the heart at all. It happens right in your stomach. Sign number 5, the persistent heartburn indigestion. Let us talk about Richard, a 69-year-old retired mechanic from Pennsylvania. Richard loved a good hearty meal, but he noticed that lately, almost every time he ate, he developed a burning sensation right in the upper part of his stomach and lower chest. He assumed it was acid reflux, or GERD. He began keeping a bottle of antacids in his pocket, popping them like candy after lunch and dinner. One afternoon, Richard was clearing some brush in his backyard. About 10 minutes into the yard work, that familiar burning indigestion hit him hard. He stopped, took 2 antacids, and waited. But this time, the burning didn't go away. It seemed to radiate slightly up into his neck and left shoulder. He felt a bit nauseous and broke out into a cold sweat, despite the weather being cool. He went inside, laid down on the sofa, and told his wife he must have eaten some bad sausage. But here is what most people don't realize. The nerves that supply the stomach and the nerves that supply the bottom part of the heart run along the exact same highway in your nervous system. When the lower wall of the heart is starved for oxygen due to a blocked artery, the brain can get its signals crossed. It interprets the distress signals from the heart as pain coming from the stomach. This is called referred pain. Richard's indigestion wasn't acid at all. It was his heart screaming for oxygen because his coronary arteries were dangerously narrowed. When he exerted himself by clearing brush, his heart needed more blood. The blocked artery couldn't supply it, and the heartburn flared up. The problem is, treating heart-related indigestion with antacids gives you a false sense of security while your heart muscle is actively dying. For seniors, a missed cardiac event presenting as stomach pain can lead to permanent, irreversible heart damage or a sudden heart attack that could have been prevented with a simple medical evaluation. How do you tell the difference between real acid reflux and a heart issue? Real acid reflux is typically triggered by specific foods, gets worse when you lie down flat right after eating, and responds quickly to antacids. Heart-related indigestion is often triggered by physical exertion or stress, does not care what you ate, does not improve with antacids, and may be accompanied by shortness of breath, sweating, or a feeling of unexplained dread. If your chronic heartburn behaves like Richard's, stop taking the antacids and get a stress test from a cardiologist. It could save your life. Richard survived his scare because his wife insisted on calling paramedics. But our sixth sign involves a mental symptom that most families mistakenly blame on a completely different condition. Sign number 6. The sudden brain fog and dizziness. Margaret was an 81-year-old retired librarian living in Arizona. She was sharp as a tack, loved crossword puzzles, and never forgot a birthday. But over the course of a few weeks, her daughter noticed that Margaret seemed unusually spaced out. She would lose her train of thought mid-sentence. One morning, while standing up from the breakfast table to get a cup of tea, Margaret swayed violently, grabbed the edge of the table, and almost collapsed. When her daughter asked what happened, Margaret brushed it off. She said she just stood up too fast, or maybe she hadn't drunk enough water that day. She noticed that she was feeling increasingly lightheaded throughout the day, like the room was gently spinning. Her family began to worry that Margaret was developing early-stage dementia or Alzheimer's disease because she just wasn't acting like her usual sharp self. What happened next surprised them. They took Margaret to a neurologist, but the neurologist immediately sent them to a cardiologist. Why? Because the brain consumes about 20% of all the oxygen and blood your heart pumps out. If your heart valves become stiff and narrow, a very common senior condition called aortic stenosis, the heart cannot force enough blood through that tight valve to reach the brain. When blood flow to the brain drops, even slightly, it causes immediate lightheadedness, confusion, memory lapses, and dizziness. Margaret's brain fog wasn't a structural brain disease, it was a supply issue. Her brain was simply starved of the fuel it needed to function properly because her heart valve was acting like a clogged funnel. This matters because dizziness and lightheadedness in seniors lead to falls. A fall for someone in their 70s or 80s can result in a fractured hip, a loss of independence, and a massive decline in overall health quality. Furthermore, severe valve narrowing or a dangerously slow heart rate that causes dizziness can lead to sudden fainting, which is a clear sign that the heart is on the verge of stopping completely. If you or a loved one experiences sudden, unexplained dizzy spells, or if you feel lightheaded simply by changing positions from sitting to standing, do not just assume it is dehydration. Have your doctor listen to your heart with a stethoscope. A stiff valve creates a very distinct, loud sound called a heart murmur that a trained physician can detect in seconds. They can also check your resting heart rate to ensure it isn't dropping into a dangerously low zone that requires a simple pacemaker to fix. Now we have reached our final 7th sign, and it is perhaps the most subtle and easily missed of them all, because it occurs while you are fast asleep, and it involves your breathing patterns. Sign number 7, the gasping sleep interruption. Our final story involves Thomas, a 76-year-old veteran from North Carolina. Thomas was a heavy sleeper, but his wife Linda started noticing a terrifying pattern at night. Thomas would be snoring loudly, and then suddenly, his breathing would stop completely. The room would go dead silent for 10, 20, sometimes 30 seconds. Linda would lie awake, terrified, waiting for him to breathe. Then, Thomas would suddenly gasp violently for air, snort, turn over, and resume snoring. When Linda confronted him about it, Thomas laughed it off. He said he had snored his entire life, and it hadn't killed him yet. He did admit, however, that he was waking up every morning with a pounding headache and a bone-dry mouth, feeling like he hadn't slept a wink, even though he was in bed for 8 full hours. What Thomas was experiencing is called central sleep apnea, and it has a profound bidirectional link to heart failure. When your heart is struggling to pump blood efficiently, the chemical sensors in your brain that monitor oxygen levels get confused. They fail to send the proper signal to your respiratory muscles, telling them to breathe. This causes your breathing to repeatedly stop and start during the night. Every time you stop breathing, your blood oxygen levels plummet, and your body releases a massive surge of stress hormones like adrenaline to wake you up and save you from suffocating. This adrenaline surge causes your blood pressure to spike dramatically in the middle of the night, putting an unbelievable amount of structural strain on an already weakened heart muscle. Left untreated, severe sleep apnea accelerates heart failure, thickens the walls of your heart, and can trigger fatal heart rhythms while you are asleep. If you snore heavily, if your partner notices that you stop breathing at night, or if you wake up gasping for air or feeling completely unrefreshed in the morning, you need to take action. Request a sleep study from your doctor. Utilizing a simple, quiet device called a CPAP machine keeps your airways open, stabilizes your oxygen levels, and instantly removes that massive overnight workload from your heart, allowing it to rest, heal, and recover while you sleep. Your heart is an incredible, resilient muscle that works every second of every day to keep you moving, but it relies on you to pay attention to its warning signs. Unexplained exhaustion, puffy ankles, a nighttime cough, chest fluttering, persistent indigestion, dizziness, and nighttime gasping are not just a normal part of getting older. They are your heart's way of asking for help. Listen to your body, advocate for your health, and never hesitate to get checked out by a medical professional. If you found this video helpful, please give it a thumbs up, share it with your friends and family on Facebook, and leave a comment below sharing your thoughts. Stay healthy, stay proactive, and I will see you in the next video.